Thank you, Mr. Speaker. Mr. Speaker, with the health inquiry underway and a long list of evidence of our doctors being bullied and intimidated, it's clear that this government continues to mismanage our healthcare system. And what better example today than this government's plan to build 140 of these family care clinics with no idea how much they'll cost or how we'll pay for them, and as typically with this government, it's become more apparent that they have no idea how to staff these clinics. My question is simple. How does the Health Minister plan to staff family care clinics without pulling nurses and frontline staff away from hospitals and primary care networks?
Honourable Minister.
Mr. Speaker, this government is doing a lot of things in healthcare, and what we did this morning was, with the assistance of the Honourable Premier, we opened the K Edmonton Clinic, a $484 million facility that will provide, Mr. Speaker, a variety of frontline services to Albertans, including consultations with specialists, including access to diagnostic imaging under one roof. Mr. Speaker, this facility and the operations that go on within it will work very closely with both primary care networks and family care clinics that are serving the capital region, staffed by competent, enthusiastic health professionals who believe in the benefits of primary care for the communities they serve.
Honourable Member, your supplemental, no preamble.
Thank you. Given that this minister has repeatedly in this House refused to tell Albertans the cost of family care clinics per patient, and given the numbers that we have documents is $300 per patient for family care clinics versus $62 per patient for primary care networks, will he finally tell Albertans how much these clinics will cost?
Honourable Minister.
Well, Mr. Speaker, I don't know what kind of healthcare policy the official opposition is developing. The work that this government is engaged in, Mr. Speaker, is improving all aspects of primary healthcare across the province. If the honourable member wants to focus on the merits of one particular model over another, that's certainly up to her to do. We're interested in providing better access to family physicians, nurse practitioners, dietitians, and other professionals, supported by a common set of standards and tools that truly equip them to do the job, Mr. Speaker.
Honourable member.
Given that this government is facing a deficit, and given that this minister can't tell us the cost of family care clinics versus primary care clinics, I'd like to ask him one more time. What is the cost per patient for family care clinics versus primary care clinics?
Mr. Speaker, if the honourable member wants to play with the dynamics of health economics, I leave that up to her. What we're interested in, Mr. Speaker, is building and improving upon the work of primary care networks. There are 40 of them serving Alberta. We are looking at similar opportunities with family care clinics. As the honourable member knows, we're spending over $181 million in support for PCNs today. We've allocated a further $75 million in this budget and for the budget for the next 2 years to support family care clinics and other primary health care initiatives. That adds up for us, Mr. Speaker.